That stiffness when you first get out of bed in the morning. The ache that starts in your lower back and spreads down into your hips and thighs by afternoon. The muscle spasms that come out of nowhere, sometimes so severe they stop you mid-step. The feeling that your back is constantly on the edge of going out. You have probably been told this is arthritis, disc degeneration, the price of getting older. But I want to show you something that permanently changed how I treat back pain in my senior patients. Two patients, same age, 69, same MRI findings, moderate lumbar disc degeneration, mild facet arthropathy, both told by previous physicians that their back pain was the natural result of aging. That management, not cure, was the only realistic goal. Patient 1 went on anti-inflammatory medication and physical therapy. 6 months later, modest improvement. Still in daily pain, still limited in activity. Patient 2, I tested one specific blood marker that most physicians never check in back pain patients. It came back severely deficient. I corrected that deficiency over 12 weeks. 6 months later, back pain reduced by more than 60%. No surgery, no injections, no ongoing medication. Same structural findings on imaging. Completely different outcomes. Because the muscles of your back, the deep stabilizing muscles that hold your spine in place, that contract and release with every single movement you make, require one specific mineral to function properly, to contract fully, to release completely, to avoid the chronic low-level spasm that is the single biggest contributor to ongoing back pain in seniors over 60. When that mineral is deficient, which it is in an estimated 70% of adults over 60, those muscles cannot fully relax. They stay in a partially contracted state. They fatigue quickly. They go into spasm at the slightest provocation. And the pain they produce is labeled as arthritis, as disc degeneration, when the actual cause is a correctable nutritional deficiency that is sitting right there in your blood, waiting to be identified. That mineral is magnesium, and the reason it is almost never identified as a back pain cause is that the standard blood test for magnesium misses 70% of true deficiencies. You can be severely depleted in the muscles and tissues of your back while your blood test reads completely normal. I have spent over 25 years in medicine, focused on senior health. And today, I am going to give you everything: why magnesium deficiency causes back pain, how to test for it correctly, and exactly how to fix it in a way that works for the aging body. Stay with me because the second half of this video contains information that most seniors with back pain have never been given by anyone. Please, before we go any further, if you are not yet subscribed to this channel, hit that subscribe button and tap the bell icon right now. I post new senior health videos every single week, practical research-based information that your doctor may never have time to explain in a 10-minute appointment. You do not want to miss what is coming. Subscribe now, then let us get into everything about magnesium and back pain. Let me start with the fundamental question. What exactly is magnesium doing in your back muscles? And why does its absence cause so much pain? Magnesium is the fourth most abundant mineral in the human body. It is involved in over 300 enzymatic reactions, everything from energy production to DNA synthesis to protein formation. But for understanding back pain, three specific roles are most critical. The first is muscle contraction and relaxation. Every muscle contraction in your body, including in the deep spinal muscles that stabilize your vertebrae, requires both calcium and magnesium. Calcium triggers the contraction. Magnesium triggers the relaxation. This calcium-magnesium balance is essential for normal muscle function. When magnesium is insufficient, the relaxation phase of muscle activity is impaired. Muscles that should fully release after contracting instead remain in a state of partial contraction, a low-level sustained tension that the brain does not fully register as voluntary movement, but that the muscles experience as chronic exhausting effort over hours and days. This sustained partial contraction produces the deep, relentless aching that so many seniors describe as their back pain. Not sharp, not stabbing, just a constant, heavy, exhausting ache that is always there. And here is something most people never get told. A muscle that is already locked in that chronic tension can go into a full, violent spasm from something as harmless as reaching for a glass on a shelf. I have had patients call me from the floor, unable to move because they bent down to pick up a piece of paper. That is not aging. That is a muscle that was never given what it needed to relax. The second role is nerve signal regulation. I want you to picture your nerve cells like electrical wires. Now imagine the insulation on those wires slowly wearing away. Every signal that passes through becomes louder, more distorted. more painful than it has any right to be. That is essentially what happens when magnesium disappears from the picture. Magnesium sits inside specific receptors on nerve cells and physically blocks the nerve from firing pain signals too easily or too intensely. When it is gone, the nerves of your back become hyper-responsive. Movements that should be painless become agonizing. The back feels fragile and unpredictable in a way that goes far beyond what any imaging would show. I have seen patients with relatively minor disc findings who were in absolute agony, and I have seen patients with severe imaging findings who felt almost nothing. The difference, more often than not, came down to this. The third role is inflammation regulation. Magnesium deficiency directly promotes inflammatory activity in the tissues around your spine. It increases the production of a specific inflammatory compound that both amplifies pain signals and drives tissue inflammation in spinal discs, facet joints, and the muscles alongside your spine. When magnesium is adequate, this inflammatory cascade is suppressed. When it is deficient, it runs unchecked. And while your doctor is pointing to an MRI image, explaining what they see structurally, the actual fire burning in your back is being fed by something nobody checked for. Please stay with me. What I am about to explain is exactly why this keeps getting missed, and it is going to make you angry. Now, I want to explain why this deficiency is so extraordinarily common in seniors over 60, because most people assume that if they are eating a reasonably balanced diet, they should be getting enough magnesium. And that assumption is largely wrong for three specific reasons. The first reason is reduced dietary intake. Here is the brutal truth. Most seniors are simply not eating the foods that contain meaningful amounts of magnesium, and it is not entirely their fault. Appetite changes. Food preferences shift. Chewing becomes harder. The variety in the diet shrinks. When I sit with older patients and actually walk through what they are eating in a typical week, I am rarely surprised anymore. The richest sources of magnesium are foods that have quietly disappeared from most senior diets, and I want to list them for you now, starting with the ones I almost never see anyone over 65 eating regularly, working toward the ones people do include occasionally. Coming in last, almost nobody I treat actually eats these consistently, are whole seeds like pumpkin seeds and hemp seeds. Before that, legumes such as black beans and lentils, foods I hear seniors say they avoid because of digestive discomfort. Before that, nuts, particularly almonds and cashews, which many seniors skip because of dental issues or fear of choking. And the one food that does appear occasionally but still falls far short in quantity, dark leafy greens like spinach and Swiss chard. Even when these foods are present in the diet, the portion sizes are rarely enough to meet daily requirements, and that brings us to reason number 2. The second reason is impaired absorption. Even if you were eating every single item on that list every single day, your aging gut may simply not be pulling the magnesium out of those foods efficiently. Stomach acid production declines with age, and stomach acid plays a direct role in magnesium absorption. Now add to that the medications. I cannot tell you how many patients come to me on long-term acid reflux medications, proton pump inhibitors, and have absolutely no idea that those pills are actively draining their magnesium. I had one patient, a 74-year-old retired teacher named Dorothy, who had been on a PPI for 11 years for mild reflux. 11 years. Her doctor kept renewing it without question. When I finally tested her properly, her magnesium levels inside her cells were catastrophically low. She had been living with back pain, cramps, and fatigue for years, and nobody had ever connected those dots. If you are on a blood pressure medication, a diuretic, or you have diabetes or pre-diabetes, your body is losing magnesium through your urine at an accelerated rate every single day. This is not a small effect. This is significant ongoing loss happening silently. The third reason is the one that makes me genuinely furious on behalf of my patients. The test most doctors order to check magnesium tells you almost nothing useful. Here is why. Only about 1% of all the magnesium in your body is floating in your blood. The other 99% is locked inside your cells, inside your muscles, your bones, your organs. Your body is extraordinarily protective of blood magnesium levels. It will strip magnesium from your muscles and your tissues to keep blood levels looking normal. So your blood test comes back fine. Your doctor nods, no deficiency detected. And meanwhile, your back muscles are running on empty. I had a 68-year-old man, a former electrician named Gerald, who came to me after 4 years of worsening back pain. Every previous test had come back normal. His serum magnesium, the standard blood test, was 2.2, technically within range. But when I ordered the correct test, the one that looks inside the red blood cells where magnesium actually lives and works, his level was 3.8. He was severely depleted. 4 years of pain, 4 years of normal test results, 4 years of misdiagnosis. If that does not make you want to pick up the phone and call your doctor right now, I do not know what will. The test you need to ask for by name is the red blood cell magnesium test. Some labs call it intracellular magnesium. It measures what is actually inside your cells, which is where it matters. It is widely available. It costs very little, and almost no one orders it without being specifically asked. Now let me tell you about a patient of mine named Thomas. Thomas was 73 years old when he walked into my office, and I use the word walked loosely because he was hunched, moving carefully, clearly in significant pain with every step. Thomas had been dealing with severe lower back pain for 7 years. 7 years. He had seen multiple orthopedic specialists. He had had 3 MRIs. He had been through 2 full rounds of physical therapy, a series of epidural steroid injections, and more anti-inflammatory medication than his stomach could handle. His most recent specialist had recommended spinal fusion surgery. Thomas had one daughter who begged him to get one more opinion before going under the knife. That is why he ended up sitting across from me. When I reviewed his records, the first thing I noticed was that in 7 years of treatment across multiple specialists, nobody had ever once checked his magnesium. Not the standard test, not the accurate one, nothing. His MRI showed disc degeneration at L4, L5, and L5, S1. Common findings in men his age, and present in a large percentage of men his age, who are completely pain-free. His structural findings were real, but they were not extraordinary. I ordered a red blood cell magnesium test. His result came back at 3.9 milligrams per deciliter. The optimal range is 5.5 to 6.5. He was severely depleted at the cellular level. His serum magnesium, meanwhile, read 2.1, technically normal, exactly why it had been missed for 7 years. I started Thomas on magnesium glycinate, 400 milligrams at bedtime, and recommended specific dietary changes to support ongoing intake. I also recommended transdermal magnesium oil applied directly to his lower back muscles twice daily, which bypasses the gut entirely and delivers magnesium straight into the muscle tissue beneath the skin. At his 6-week follow-up, Thomas told me his nighttime back pain had significantly reduced. The muscle spasms that had been waking him up at 2 in the morning were happening less frequently. He said, and I remember this clearly, I actually slept through the night for the first time in years. At his 12-week follow-up, he described his overall pain level as reduced by roughly 50%. At 6 months, Thomas had not had spinal fusion. He had canceled that surgical consultation. He told me it was the first time in 7 years he felt like he might actually get his life back. Thomas still has disc degeneration. That has not changed and will not change. But the pain, the debilitating, life-limiting, surgical recommendation-generating pain, was being driven primarily by severe magnesium depletion in the muscles and nerves surrounding that degeneration. Correct the depletion, and the pain responds in a way that no surgical procedure could have achieved. And that is not a small thing. That is everything. Please, if someone you care about is facing a recommendation for back surgery right now, share this video with them before they make that decision. Now let me give you the complete practical protocol. Exactly what to take, how much, when, and in what form. Because the form of magnesium matters enormously, and I see people getting this wrong constantly. There are many forms of magnesium supplement on the market: magnesium oxide, magnesium citrate, magnesium glycinate, magnesium malate, magnesium threonate, magnesium chloride. They are not equally effective, and they do not all do the same thing in your body. Magnesium oxide is the most common and cheapest form. You will find it in most standard multivitamins. Here is the problem: only about 4% of it is actually absorbed from your gut. The rest passes straight through. It is largely useless for correcting the kind of deep muscular and neurological depletion we are talking about today. If your multivitamin lists magnesium oxide on the label, I am sorry to tell you, it is doing almost nothing for your back. Magnesium glycinate is the form I recommend first for back pain specifically. It is highly bioavailable, efficiently absorbed from the gut, and the glycine molecule it is bonded to has its own muscle-relaxing and sleep-improving properties that directly complement what we are trying to achieve. Less spasm, less nighttime pain, deeper, more restorative sleep during which your tissues actually repair themselves. The starting dose for back pain in seniors is 300 to 400 milligrams of elemental magnesium as glycinate, taken at bedtime. Bedtime is ideal because the muscle-relaxing effect works best when your back is not under the constant demand of upright activity, and because the glycine component promotes deeper sleep. Magnesium malate is the preferred form if you want to take a second dose during the day. It is less sedating than glycinate, and the malate component actively supports energy production in muscle tissue, which helps reduce the fatigue and soreness that comes from chronically tense back muscles. Transdermal magnesium, meaning magnesium chloride oil or lotion applied directly to the skin over your lower back. Bypasses every gut absorption issue entirely. The magnesium absorbs through the skin and reaches the underlying muscle tissue directly. This is particularly valuable for seniors on medications that impair gut absorption. Apply it to the lower back and hips after a warm shower when the pores are open. Twice daily. It is not complicated and it makes a real difference. One important caution: magnesium supplementation can cause loose stools or diarrhea if the dose is too high, particularly with forms like citrate or oxide. Glycinate is the gentlest on the gut. Start at the lower end of the dosing range and build up gradually over 1 to 2 weeks. And if you have any history of kidney disease, or if your kidney function tests have come back abnormal, please consult your physician before starting magnesium supplementation. Impaired kidneys cannot excrete excess magnesium efficiently, and that is a situation that requires medical supervision. Do not skip that step. Let me bring everything together for you now. Chronic back pain after 60 is not just about what shows up on an MRI. It is being driven in a significant number of seniors by magnesium deficiency that causes three specific and correctable processes: chronic muscle spasm from impaired relaxation, hypersensitive pain signaling from lost nerve protection, and an elevated inflammatory environment feeding ongoing tissue pain. 70% of seniors are deficient. The standard blood test misses most of it. The red blood cell magnesium test is the accurate measure, and magnesium glycinate at 300 to 400 milligrams at bedtime, supplemented with transdermal magnesium oil applied to the lower back, is the most effective correction protocol for the muscles and nerves specifically involved in back pain. Thomas canceled his spinal fusion, not because surgery is never the right answer, sometimes it genuinely is, but because his pain was not primarily a structural problem. It was a nutritional problem that had been missed for 7 years, while increasingly aggressive and expensive interventions were being lined up. Before you agree to any invasive treatment for your back pain, please, I am asking you directly, ask your doctor for a red blood cell magnesium test. It is a simple blood test. It costs almost nothing, and it may reveal a correctable cause of your pain that has been sitting there unidentified for years while you suffered through it unnecessarily. If this video gave you something genuinely valuable today, please do 3 things right now. First, give this video a thumbs up. It helps this information reach more seniors who deserve to know it. Second, leave a comment below. Did you recognize your own back pain in what I described today? Have you ever had your magnesium properly tested? I personally read every single comment and reply to as many as I can. And third, share this video with someone you know who is living with chronic back pain and has been told it is just aging. You may be handing them the piece of information that changes everything. Subscribe to this channel for weekly senior health videos that are honest, research-based, and always practical.